Hi everybody, thanks for tuning in to my PowerPoint presentation on type 2 diabetes education and management. My name is Stephanie Schofield and I am both the creator and presenter of this PowerPoint. The objectives for today's educational PowerPoint are to define type 2 diabetes, explain how to diagnose type 2 diabetes, review the risk factors for type 2 diabetes, discuss ways to manage type 2 diabetes, and lastly, acknowledge the importance of managing type 2 diabetes. So the first thing we're going to look at today is what is type 2 diabetes? And one simple definition that I came across while doing my research stated that type 2 diabetes is a chronic condition that causes high levels of blood glucose. And glucose is also known as sugar. Type 2 diabetes can be caused by one or both of two reasons. Either one, the body's inability to secrete insulin, and this is due to destruction of B cells in the body that produce insulin. Or two, the body's inability to absorb insulin. So let's recap. It's caused by one or both of two reasons, either the body's inability to secrete insulin or the body's inability to absorb insulin. And thankfully, type 2 diabetes can possibly be prevented, and it also is possible for remission if certain things in life, certain changes are made, and specifically pertaining to your lifestyle. So individuals with prediabetes may be able to prevent becoming a diabetic with good diet, exercise, weight loss, and stress management. And with proper diet, exercise, stress management, and medication adherence, type 2 diabetes can potentially be controlled and possibly go into remission, which requires no medication use. So these people who were once a type 2 diabetic will no longer require taking medication. However, they will have to continue to watch their diet and their exercise and their stress levels in order to continue to make that possible. Lastly, management is crucial to one's overall quality of life because diabetics who fail to manage their blood sugars can unfortunately develop chronic disease process, such as heart disease, vascular disease, eye and kidney disease, and nerve damage, which overall affects their quality and longevity of life. Next, we're going to be looking at the different tests used to diagnose type 2 diabetes. There are four common tests that I came across in my research studies. And the first was a fasting plasma glucose. And to perform a fasting plasma glucose, the individual needs to fast for at least 8 hours prior to obtaining the blood sugar sample. There's also a 2-hour plasma glucose, and this is also known as an oral glucose tolerance test because it requires the individual to drink 75 grams of sugar mixed in water, and then after 2 hours passes, the blood sugar reading is taken. There's also a test called a random plasma glucose, and the interesting about this one is there are no rules or steps to take with a random glucose test. This test can be performed at any time of the day. And then lastly, there is the A1C, and unlike other tests used to diagnose diabetes, this test cannot be performed at home. It has to be performed in a laboratory, and it is actually the most common test used to diagnose and treat diabetes. So on the right, you'll see the plasma glucose readings and the lab readings for the A1C. Here we look at just a few of the symptoms of type 2 diabetes. increased thirst, unexplained weight loss, increased hunger, fatigue, slow healing, numbness in the hands or the feet, blurred vision, frequent urination, and dry skin. So symptoms develop slowly, and some people may not experience any symptoms at all. Therefore, it is important to see a healthcare provider if you have symptoms because early diagnosis and treatment can significantly change the quality of life. Now we're going to look at risk factors for type 2 diabetes. Listed are just a few of the common risk factors for the development of type 2 diabetes, and some risk factors are preventable by decreasing BMI, following a healthy diet, implementing exercise, decreasing stress, and following proper medication management. One thing I want to note here is that the number one risk factor for developing type 2 diabetes is obesity. That is why it's so important to follow a good diet and exercise regimen to either prevent type 2 diabetes or manage it. The first risk factor we're going to look at is obesity. And as I said on the prior slide, obesity is the number one risk factor for the development of type 2 diabetes. It is diagnosed when you have a body mass index over 30. So here on the right, I did put a chart that will show you when somebody's BMI is 18.5 kilograms, they are underweight, or when they are 30 or greater, they are considered to be in an obese class. So to calculate the BMI, we divide a person's weight by their height, and then we could use that number to look at the right column where it says BMI, and then click that number into there to then go to the left and say, oh, wow, this person's overweight, this person's underweight, this person's a healthy weight. Unfortunately, obesity does affect individuals of all races, ages, sex, and it is non-discriminatory. Patients with obesity should be screened for diabetes. And again, poor diabetes management can lead to chronic disease processes and poor overall health outcomes. Therefore, individuals who know their BMI and want to lose weight should aim for approximately 10% of their overall weight to be lost in order to maintain a positive metabolic effect on their blood sugars. Next, we're going to look at ethnicity. Some ethnicities are more likely to develop type 2 diabetes than others. And I put here for an example, the American Indian Alaskan Native population are 2 times more likely to develop type 2 diabetes than the non-Hispanic white population. Unfortunately, ethnicity is unable to be changed, and therefore diet, exercise, weight loss, and stress management are highly important for those ethnicities that are more likely to develop type 2 diabetes. Next, we're going to look at age. As I said on the prior slide, diabetes is non-discriminatory. It's a disease process that in most cases can be prevented. Onset of type 2 diabetes can develop at any age during any stage of development. Although historically it is documented as a diagnosis made in the aging elderly population, diagnosis of type 2 diabetes has become increasingly common in children and young adults. The diagnosis of type 2 diabetes at a younger age is more likely to cause severe complications than onset at an older age. Therefore, individuals diagnosed with type 2 diabetes at a young age are more likely to be diagnosed with chronic health conditions such as diabetic retinopathy. Another risk factor we're going to look at is sedentary lifestyle. And individuals with a sedentary lifestyle tend to do more sitting, leaning, or lying down while awake versus walking, standing tall, or running. A sedentary lifestyle affects an individual's metabolism and can lead to obesity, which is, again, the number one risk factor for development of type 2 diabetes. A sedentary lifestyle may lead to an increase in trunk and body fat percentage, as well as a decrease in skeletal muscle. And increased sedentary time actually has been shown to increase A1C levels significantly. Another risk factor is gestational diabetes. And gestational diabetes is a diagnosis of diabetes made during pregnancy. In fact, research shows that gestational diabetes affects between 4 to 10% of all pregnancies in the United States every year. Research also shows that there's an increased risk for the mother to develop gestational hypertension or preeclampsia, and in some cases, a cesarean section is necessary due to a high birth weight. Unfortunately, gestational diabetes increases the risk of type 2 diabetes development in both mother and child. And solid data exists showing the relationship between gestational diabetes and the development of maternal cardiovascular disease. The last risk factor we're going to take a look at is prediabetes, and this is the beginning signs of impaired glucose metabolism. So during this time, individuals are showing high levels of glucose in their blood. However, the levels are not yet high enough to diagnose diabetes. And the prevalence of prediabetes is higher in older adults. However, as stated earlier, prediabetes can affect individuals of any age, sex, or race. Once again, obesity or an increased BMI is the number one risk factor for developing prediabetes, and therefore individuals need to implement a healthy diet and they need to commit to a routine exercise schedule, because if they do not, prediabetes will most likely advance to a diagnosis of type 2 diabetes. Next, we're going to talk about ways that type 2 diabetes can be managed. So studies suggest that 7 self-care practices are the key to managing blood sugar levels. And they are the assessment of sugar levels in the blood, consuming healthy foods, remaining physically active, taking medications regularly and on time, maintaining healthy behavior, and decreasing risk factors. The first way we can manage diabetes is to ensure that we maintain our wellness checkups. And wellness checkups and exams are critical to properly managing type 2 diabetes, as well as slowing the chronic disease process that come along with it. A registered dietitian can be a great help by creating a diet and meal plan that is specific to your body and your palate. Typically, patient-specific diet plans can increase compliance and lower blood sugar levels. Type 2 diabetics are often prone to developing foot ulcers, therefore, feet should be washed with soap and water and dried gently with a soft towel. And any observation of edema or injury should be immediately reported to your primary care or podiatrist. With regular checkups, we can prevent the early onset of diabetic retinopathy, which is a chronic disease process that develops secondary to type 2 diabetes. Another way we could manage type 2 diabetes is by implementing lifestyle changes. and lifestyle changes are crucial to diabetes management. However, as we stated earlier, there is no universal diet that suits every diabetic patient. Therefore, we must individualize diet plans. In general, the recommendations for type 2 diabetes is to eat more non-starchy vegetables and more whole grain foods while avoiding any added sugars, refined grains, or processed foods. Also, regular exercise regimens are essential because they not only help with weight loss, but they also improve blood glucose levels, decrease stress, and reduce the risk of developing chronic disease processes such as cardiovascular disease. It is so important to replace poor coping mechanisms such as drinking or smoking with healthy coping mechanisms such as yoga, walks, or meditation to decrease the risk of developing chronic disease processes. Another way to manage type 2 diabetes is by monitoring your blood sugar at home. And so we're going to do a quick review of how this is done. You want to collect everything that you need, such as a glucose monitor, lancets, glucose testing strips, alcohol prep pads, and gauze. It is recommended that the skin be prepared by washing with soap and water or using an alcohol prep pad to remove any debris. You're then going to take the protective cover off the lancet and you are going to place your glucose test strip into the blood glucose machine, which then should turn the machine on. You want to firmly apply the lancet to the prepared site and press to pierce the skin. The first drop of blood that you get after you pierce the skin, you want to wipe that away because in some cases the first drop of blood can give a poor blood sample and it could lead to false results. After you do that, you want to collect the second drop of blood using the clean test strip that is in the blood glucose monitor. And once the blood sample is obtained, you want to apply pressure to stop any further bleeding from the puncture site. The monitor should now give you a blood sugar reading, and the results should be documented in a log that can be shared at your next primary care visit. Lastly, you always want to wash your hands and place the equipment back in the storage bag for safety and easy access. One last way to manage type 2 diabetes is to simply stay organized. You could keep a weekly planner, and I show you here where I document when I'm going to go to yoga, when I have a birthday party, and then you could see on Tuesday the 9th where I put my blood sugars in. The PM blood sugar was a little bit high, and so I documented there that I had some birthday cake that day. Just so I know that, there is a reason why my sugar might have been a little bit elevated. I also show you here on the right a medication organizer, and this can help keep all your pharmaceutical drugs and appliances in the same spot for easy access. Last but not least, why is diabetes management important? Well, it reduces the risk of developing chronic health conditions secondary to diabetes, such as heart disease, kidney disease, peripheral vascular disease, neuropathies, and limb amputations. It also plays a significant impact on a patient's longevity of life as well as their overall quality of life. In conclusion, type 2 diabetes is a chronic metabolic condition. Diagnosis of type 2 diabetes is made by blood testing. Some of the major risk factors for type 2 diabetes are preventable. And understanding how to properly manage type 2 diabetes is the key to quality of life. Lastly, diabetes management decreases the risks of other chronic health conditions. Thank you again for participating in this educational PowerPoint. I hope that you've learned something and you have a wonderful day.